I think we've got some real success stories based on what staff have suggested.
We make the project and the service available to them when it's easy.
When I go home, I feel that, yes, I've done something good in my day's work.
I think working in Greenwich is a very on-the-ground, real place.
To me, it's just part of my everyday job. If I can help these children, that's what I'm here to do.
Serving such a vibrant population with such diversity has been brilliant.
Greenwich has a long and distinguished history and is also one of the most culturally diverse boroughs in London, where you can hear dozens of languages spoken on its streets. Providing excellent healthcare to everyone, whatever their background, has long been a priority for the NHS in Greenwich. Before the creation of the PCT 10 years ago, the NHS already had a strong track record in commissioning and delivering services which met people's needs and helped them to look after their own health. With the advent of Greenwich teaching PCT 2 years later, it was important that staff were encouraged to stay with the organisation and then motivated to work even harder to bring about improvements in services.
We talked to our staff about what would make it attractive to stay here and also to apply and to work here. And one of the key things was about people were very motivated to improve services. And so we put a lot of time into listening to staff's ideas about how we could improve services and putting those into action. We also did a lot of focus on things like flexible working so that staff were able to work while juggling their busy lives. So we've really tried to build on the staff that we have, and we've got to the point where we are seen as an attractive place to work, and staff have been here, some of them like me, have been here right from the beginning, and others have joined us from other areas. And I think we've got some real success stories based on what staff have suggested.
The trust grew from 500 people to 1,000, most of whom were clinical staff. Their expertise in treating people at home rather than have them go into hospital has led to the expansion of this kind of service. The effect has been felt by staff as well as patients. Carol Severs and Mary Nash are community cardiac matrons who look after people in their own home with serious heart problems.
When I worked in hospitals, if you dealt with one patient, you were always conscious of other patients wanting your attention elsewhere. Whereas when you go to see people in their own home, you've got to remember you're a guest in their homes. They've invited you in. You see them in how they really are. If they come to a hospital or clinic, they can put on an act, because they're coming into your environment. But if you go to see them at home, you're going into their own home, into their environment, and you see how they live, and you can sometimes see where the problems are and find solutions to help them manage better, really.
The patients that we see are generally quite poorly, so it's about developing trust and working with the patients and their families and educating them to manage their conditions. And when I go home, I feel that, yes, I've done something good in my day's work.
Taking the services out into the community, though, is not just about looking after people who are already poorly. It's also about prevention too. The mobile health unit goes across the borough so people can be seen by health professionals. No appointments are necessary. The unit has already played a key role in improving health, for example, spotting undiagnosed high blood pressure and then ensuring patients were able to get help from their GP. The Stop Smoking service, teaming up with Charlton Athletic Football Club, is a regular visitor to some of the busiest places in the borough, such as supermarkets and high streets. It's part of the work of Greenwich's Public Health Directorate. The aim is to target smokers who wouldn't go to their GP or the Stop Smoking service for help to quit.
Well, there's a lot of people, particularly people like my dad, he never went near a GP surgery, and those kind of people who wouldn't go even if his arm had dropped off. We make the project and the service available to them when it's easy, when they're just going shopping, they can just pop in. We're doing lung age readings so that people can find out how old their lungs are. We do CO readings, and with this particular project with the Lung Age Roadshow, we've been doing one-to-one support over a period of 9 weeks out in the community, so people can get the 7-week support that you'd normally get from a group actually out in the street as well with us.
The Stop Smoking service also helps staff at Belmarsh Prison to give up and has since developed links to work with them and the inmates to prevent poor health in the future. Walk-in health centres like the one in Thamesmead and other surgeries such as Garland Road and the Wallace Centre, visited by the former Health Minister Ben Bradshaw, have all helped to improve access to healthcare for people in Greenwich. As well as local improvements, the Trust has been at the forefront of national initiatives like the screening programme for sickle cell and thalassemia, which affects people whose family background is from Africa and the Caribbean. One of Greenwich's public health consultants, Dr. Allison Streetley, was given an OBE in recognition of her work in setting up the national programme, which also runs locally. Through her work, she then discovered the highest incidence of the disease in the country was actually in the borough. It's another example of the pioneering role staff have played in important innovative projects over the last 10 years.
Both sides can benefit because understanding the national helps you bring things into the local, and understanding the local helps you keep your feet on the ground when you're doing a national job, because national people can get very detached from reality, and I think working in Greenwich is a very on-the-ground real place. So it's helpful to be there because you realise how many other issues people are dealing with, and your particular issue is only one of many.
Okay, there we go.
One of the major changes in the past 10 years has been the way staff have been encouraged to have more say in their own career development and how they work. Suzy Taylor was a podiatrist and an NHS manager looking after patients and paperwork. When the clinic in Charlton wanted to be able to do minor operations rather than send people to hospital, Suzy decided to train as a podiatric surgeon with the encouragement and support of the Trust.
I started doing my entrance exams, and then Greenwich has been just so supportive. They've allowed me to work flexibly. Throughout my 10 years here, I've been a flexible worker on a different type of working pattern as my life has evolved. I started off caring for 4 grandparents when I first joined the Trust, and then needed to change my working patterns as I went along. And that gave me a day a week of my own, which I could go and supplement my training with a day a week in Lambeth PCT. And that was all made possible by Greenwich, really. They've been thoroughly supportive.
Vicky Lambert was presented with a Staff Recognition Award after she set up, with the backing from her managers, a scheme to help disabled youngsters play sport.
Well, I think it was a little bit of an embarrassment, really, because to me it's just part of my everyday job. If I can help these children, that's what I'm here to do. It did take some time out of my personal life, but you get so much satisfaction. All it takes is for the child to say how much confidence they've got or how they've finally been able to play sport with their family. It's just, I felt a little bit humble, really, because I didn't really feel like I'd done anything particularly special.
Since its creation, the NHS has had to contend with the swings and roundabouts of change, and staff have been praised for the way they've carried on throughout.
We had a lot of new community services coming through in 2 or 3 years, and they started off as quite individual services. So for the staff to be able to sell the services to other professionals, to GPs, to the hospital, to have trust in those services because they were new, I think has been really part of the inheritance that we leave, I think, for those coming in, is how the staff have coped with all of that change.
The next stage in the NHS journey in Greenwich will see GPs move towards commissioning services, but the doctors expect to take on board many of the lessons learned by the Trust over the past 10 years.
I think Greenwich has put in place a very robust and very integrated support team for GPs in terms of finances, in terms of medicine management in particular has been very helpful. In terms of appraisal, which I took a significant part in. And I think these principles upon which GPs were supported through the business support unit and through what has been put in place in the last 10 years or so, I hope we'll be able to carry that on, either the principles or hopefully with as many of the people that we know worked with for so many years.
As the Trust moves on, it has fond memories of those who have steered the changes into the community services it now provides.
Greenwich is a fantastic place. It has such a diversity of population. You've got extreme pockets of wealth, extreme pockets of deprivation, just working for and serving such a vibrant population with such diversity has been brilliant.
And the lessons for the future?
I just think that everyone should be really proud of what we've achieved in Greenwich. I think that we started out from a very difficult position and we have really turned things around, and we have a fantastic reputation as an organisation, and that each of us needs to hold that as we go into our new organisations and have the confidence to influence the teams that we're working with, who may be new and different teams, that things can change, and your good ideas are really worth shouting about because they can be picked up and turn into real changes for patients and improve their lives.